Okay, today we're going to talk a little bit more about informed consent. Remember that consent is required before a healthcare worker can do a procedure or assist a patient with something. Informed consent is the patient giving permission for the healthcare worker to do whatever procedure um, or exam that they're going to be doing. It is a little more than just the patient saying, "Yeah, sure, do whatever." Um, the healthcare worker has to give some descriptions and let the patient know several things before that consent can be taken. Okay, so it can't be just like, "Oh, yeah, can I help you?" "Yeah, sure." And then you can do whatever you want. You have to let them know exactly what you're doing. You have to let them know why you're doing what you're doing. You have to let them know the consequences of not doing what they're doing, of what you're doing. Okay, so it depends on healthcare workers giving clear descriptions of the following things. Okay, you have to let the patient know their condition. You can't just say, "Oh, yeah, you need this." You just need it because you need it. You need it because you have a broken arm and the bone is displaced, and that will cut down on your range of motion later in life. Okay. You have to describe why you're doing the treatment and how you're doing the treatment. So what exactly you're doing for them, but also why. Okay. We're going to put a plate and screws in so that way we can realign the bones. You have to outline benefits and risks of the treatment. Okay, so once we put that plate and screws in, you're going to have the bones properly aligned, and then you'll have full range of motion. That's why those are the benefits of doing it. The risk might be infection. Okay, anytime we make a cut in the skin, there's that chance of infection. Um, a risk might be that the body rejects the hardware and we're back where we started. Okay. A risk of a surgery might be severe complications due to the surgery, complications due to anesthesia, leading up to possibly death. Okay. So you have to outline the good things that are going to come from the surgery and the bad things that could come. Okay. It is not at all saying that those things are going to happen for sure, but you have to let them know the things that could happen as a negative side of the treatment. Um, then you also have to let them know other options. Okay. So if we're looking at a displaced forearm, okay, one possible option is to put a plate and screws in to have that in perfect alignment. You might, that might not work for some patients, and you might want to just try and realign it with the skin closed and cast it. Okay, that would be an alternative treatment. So you have to give them those options, and then they have to come up and say, the option that I want to do is the surgery with the plate and screws. Then you also have to let them know the risks of not receiving the treatment, like I talked about. So you have a badly displaced forearm, and you tell them that you need the surgery to realign it so you can have greater range of motion. If they, d- if and let them know that if they don't do it, they might have increased chance of there will have increased chance of arthritis. They might not have full range of motion. They might have continued pain. Okay, all these things have to be discussed before you can get that informed consent. Privileged communication, okay? That is all of those conversations that happen between a doctor or healthcare provider and the patient, okay? Those are privileged. They're telling you those things because you are taking care of them. They're probably not telling you things that they would just tell anyone that they walked and ran into on the street. Okay, they're telling you things because they trust that you're there to take care of them. So the official definition is private conversations between a healthcare worker and a patient. Those that information, the patient has to give you permission to share it. Okay, anything that's said is kind of like what's said in our classroom stays in our classroom. Okay, so if we're talking about um, something rather personal, okay? And I do hope um, that you all felt that our classroom was a safe place where you could speak your mind and talk about personal things, and it wasn't going to be blabbed all over the school. Okay. So, in order for me to share something that you maybe shared with me in the classroom, I would have to have your permission for that. The exceptions to that rule are if you are telling me or you're telling a doctor that you're going to harm someone or you're going to harm yourself and that you have a plan to do those things. Okay. Then we have to report that. But other than that, anything that's said in there needs to stay in there. Okay. That's a privileged conversation you're entitled to only because you're the healthcare provider. Okay, so we have legal issues where there's obviously a right and a wrong based on what is legal and what is illegal. Okay, ethical sometimes goes along with legal issues, but ethical is more individualized. Okay, it is against the law for every single person to murder someone. Okay, that's not really anything we can debate. That's just some simple facts. I can't kill anyone, you can't kill anyone, okay? Ethical might be that I think it is unethical um, to share private information that you share with me in the classroom. Okay, so you come into the classroom and you tell me that you've been fighting with your boyfriend and that you're really upset about it. I can't. I am not legally bound to keep that information secret. Okay, um, that's not something that's a privileged conversation. Okay, now I might feel that it's unethical. I don't feel that it's right. If you came to me in confidence to tell me things like that, I don't think it's right to blab it all over school. Okay. Just earlier this year, I had a student that came to me about some very private things that were going on in her life. And it was something that was going to eventually be shared, something that, many people in the school would know about. But she came to me and talked to me about it before she talked to her parents, and many, many other people. Okay. And she didn't come to me as a healthcare provider. She came to me as a teacher and someone that she can confide in, someone that she felt comfortable sharing concerns with. Okay. So I did not have anything legally that bound me to keep that secret. However, ethically, she came to me because she trusted that I wasn't going to talk about it all over school, that I wasn't going to share her news. Okay. Um, and I kept that promise. I did not tell anyone. As other students, other teachers, other faculty members, uh, something going on, they would ask me about it or ask me if I knew, and I just kind of played the innocent, just didn't really respond either way. Okay, those are ethical dilemmas. You might think it's okay to tell everyone. I might not. Okay, there's nothing legal about it. It's just what I feel is right versus what you feel is right. Dilemma. They're problems that require us to choose between two things that conflict with each other. Okay. Um, I have right now the dilemma of I work for the hospital, I work for the high school. Both of those are pretty time consuming right now and pretty demanding. Okay. I need to have distance learning plans every single day. Um, Not super long, but they should be worthwhile. Okay. I also, on the other side, need to work at the hospital, screening patients and making sure that patients are safe as they're going back into the ER or into other departments of the hospital so I can keep my coworkers safe. Okay. The other person is supposed to be doing administrative duties at home for the high school. So, for my athletic training that I do for the high school. So, logging injuries, logging treatments, ordering new supplies for next year, all those kinds of things. Okay. So, this is a dilemma for me because I know I need to have this distance learning stuff in, but I also know that I'm earning a paycheck from the hospital. So that causes me to choose between the two. Okay. Add in a third thing, is just that I'm a mom and I wanna spend time with my kiddos, okay? So, often I have to choose, well, I'm gonna work with the hospital tonight, and work for the high school another day, and then hopefully try and get a little, afternoon game in with my kids. Or maybe we'll go outside and jump on the trampoline, okay? Those are dilemmas, trying to choose between, different obligations. Ethical boards. Okay. There are groups of people, groups of professionals that discuss unusual and controversial cases. Okay. So if we had in Health Science 1, we talked about some different ethical decisions with ethical committees, ethical boards. And we had an example where maybe there was someone on a liver transplant list. Okay. That person was an alcoholic. And the one side, the board was trying to decide whether this person should be given the liver or not because the liver came available, and trying to decide because this person's an alcoholic. If they're not an alcoholic, they don't have any. We don't have any reason to believe that they're going to damage that new liver. Of course, we would give them the liver, right? But if they have things going on that we would worry that they would get this brand new liver and they would destroy it, where someone else could have that liver and keep it healthy for many, many years. Okay. Those are examples of ethical boards. Unbiased people come in to discuss those things. They don't make a final decision, but they give advice. They give advice on what maybe you should do. Okay. Think of it like a teacher that if you have this ethical dilemma, or any trusted adult, okay, you have this ethical dilemma and you're really not sure what to do. And you go to this teacher, you go to this trusted adult, and they talk through it with you. And they go through the pros and the cons of each side and what you should do. Okay. They don't tell you, most often, they don't tell you, oh, you have to do this. Nope. It's an ethical decision. So you have to come to that decision on your own. But they're going to give you reasons and ways to think about each side of it. Mandatory reporting. Okay. Mandatory reporting. When we take it and we look at it, it's pretty simple. Mandatory, something we are required to do, something we're obligated to do, something we have to do. Reporting, think of reporting grades. So here in a few weeks, we're going to be reporting grades, and that comes out as kind of like your final grade, and it gets put on there on your record permanently. Okay, so mandatory reporting are laws that are and protect people from abuse. Okay, so if I suspect someone is a patient comes in and they're being physically abused, okay, I have to report that. I have to report that to law enforcement. I have to report it if they're a child. I have to report it to CPS. Okay, so it's to protect people from abuse because if someone is being abused, they might be scared or threatened to go report that themselves. Okay, so if I suspect it, physical, sexual, emotional neglect or abuse, I have to go report that. Okay, um, that's where we're going to stop for today. Next time, we're going to look at patient and personal safety. Okay, we're very near the end of the chapter. So I want you to look back and kind of review for the rest of the stuff for today. We're going to do a quiz is, just reviewing a lot of the vocab terms that we've had so far. That's all. I'll see you guys soon.